Thank you all for joining. The Community Connector was created in March of 2020. It was to keep the Oakland County community and the elder care service providers informed, engaged, and connected until things normalize some because of COVID. Every month we have approximately 5 speakers that have an opportunity to educate our participants about their services and how they have worked through the pandemic. Like I told you all, please put your contact information in the chat feature. That's where all the magic happens. And we encourage participation in Q&A after the presentation. And again, thank you all for joining.
Yeah, thanks, Pandora. Appreciate that introduction. Hey, David, we're going to start off with you, if you don't mind. And I know that you have a presentation, so we'll take down ours so you can share. David is the owner of, or president of Horses, Heels, Hearts, has a great story that we'd love for him to share.
Let me unmute first.
There you go.
Let me share my screen.
And you have about 11 minutes this time, David.
Okay, all right, that will help.
Awesome.
Let me get this screen shared and we'll get going here.
There we go. Thank you so much.
Okay, no problem. Once again, I am Dave Zarek. I am the president of Horses, Heel, Hearts of Michigan, and a little bit of insight about what I do as well. My full-time job is with the U.S. Postal Inspection Service, but I also serve as the vice president for the Livonia Lions Club and consult as a development on the development board for Gleaners Community Food Bank and several other charities. But horses and dogs, my passion. I do have 3 rescue dogs that are right here at my lap trying to find out what I'm doing. And not quite as big as the horses that we have, but they're just every bit as fun. What we do is we use equine therapy to kind of guide people's hearts and minds and their spirit. And what we try to do is we end up trying to just get their stress levels down and make them feel more comfortable and work with a lot of kids with disabilities, autistic children. We do have veterans that we work with PTSD, Alzheimer's patients. The gentleman here on the right side of the page was suffering from ALS, and unfortunately, the day after we visited, he had passed away. But his wife was just so thrilled to have the horse come out because he was a horseman. He really loved horses, and he rode when he was able to. And that was always his wish, was to be around horses before he died. So he got his final wish by Top Secret coming out there. So it was a very emotional day. But as you can see from some of the other pictures, the gentleman on the lower left-hand side is beaming, and he was definitely afraid of horses. He was from the Easter Seals program. So he was, had some issues going on. Definitely afraid of horses. We finally got him to ride after having him walk by their side and then getting on the horse, getting up to lead the horse. But then he got on, and it was just amazing. You could see that's pure joy, and all of his cares in the world were just diminished. And so you see, on the one center frame, we took the horses out to one of the schools so that they could do that, get the kids on there. And we usually go to the Winans Academy in Detroit on Count Day, when they have it, not due to COVID, and we've had 100% attendance because they all come out and they want to ride the horses. So just what is equine therapy? Well, it's horse therapy, and it's a type of experimental mental health treatment that involves the person in therapy interacting with the horses. And at Horses, Heel, Hearts, we like to give that one-on-one experience as well as group experiences to the people that we're serving. A couple examples of the benefits of horse therapy: you end up having a lot more respect for yourself because the horses teach you that there's something else in the world. There's something else in the world that loves you and can respect you and trust you. And it also helps them respect other people. It also helps in improve communication and social skills. Communication, I'll give you an example of one time we had a young man who was 9 years old, and he was autistic. He was non-communicative, and his mom said she hadn't heard him say a word since he was 3 years old. That was it. So 6 years of no communication. And we got him finally to trust the horse. And we got him up on the horse. And on the third time around the ring, this kid looked like a natural, looked like he had ridden forever. And the third ring around, I told him, put your hands out and show your mom how good you balance. And he did. And as he did, and she was videoing, he said, look, mom, I'm a cowboy. And it, there wasn't a dry eye in the house. And I still get goosebumps when I talk about that because it was absolutely amazing to see that. And she had it on tape. She goes, oh my God, if he never says another word, I have it. So that's the power of the horse. And they do, boundaries because the people know that, hey, this horse is a lot bigger than I am, so I have to respect it. But it also brings empathy towards others. Um, Research has confirmed there's so many studies down about the benefits. It lowers the blood pressure and the heart rate. And every time I'm around the horse, I feel that. I completely relax, and all the stresses of my day job are gone. And but we work with people that are suffering symptoms of anxiety and depression, and we've seen them change, and their attitudes are different. And also with addictions, it's because once again, they come out to the farm and they start helping out, and that shows them that there is something else that you could take care of instead of getting it go getting in and giving into your addictions. And it kind of helps them refocus. So there are sometimes a horse can teach you so many more lessons than anybody else can. They're just amazing creatures, and they're always so trusting as long as you don't abuse them, because they have that. They have incredible memories. There was one trainer who had sold his horse, and 20 years later, he went out and saw him at the farm because they'd moved across country, and he was visiting, and that horse ran to the gate, and it was like they had never been separated. They have amazing memories, and they're incredible things to work with. But people are a lot afraid of them because they are big. They're anywhere from 800 to 1,200 pounds of pure muscle. So the girl on the top corner, left-hand corner, was paralyzed from the waist down or from the neck down, and all she wanted to do is ride. And we got the mobility belt around her, had a trainer on beside her, and put 4 people walking on the sides, and she had the time of her life. Um, it had handicapped vets that get out there. And one quick story is one of the vets told me that he didn't want to go, but he promised me he would come. And he did a podcast that night and said it was the greatest thing he ever did in his life. And that's the change that they can bring to you. These are some of the groups that we work with. Different types of people and different types of conditions, but all in all, everybody gets satisfied. And the workers, the volunteers that we have, leave smiling. They talk about it. They'll send you messages, and just you're uplifting somebody's spirits. You're doing the right thing for people when people tell you that they've changed because of the experience they had with the horse. And that's what we try to bring to the community. And we're willing to work with anybody that's interested in wanting some help. We'd love to do events at the farm. We will come out to facilities to do some things, but it's getting harder on the horses as they're getting a little older. And we are training another 4 horses to have 6 horses in our training stable. COVID has kind of cut short the development of those horses because there's no crowds around them. So we do everything we can with lawnmowers and blowers and leaf blowers with tassels on them to get them to not move and budge. But there's nothing like having 119 kids in the facility screaming their lungs out, and the kids and the horses are not fazed by it at all. So we had the Avengers mentoring group there the last time, and that's what we did. So those are some of the groups we worked with. Here's the 2 mainstays of our stable are our Top Secret and Scrappy. And Top Secret's getting a little older. He's 16, but horses have a lifetime of 32 years on average. But when you've worked them, they've been working horses for a long time. This horse is special, and we do not want to lose him for any reason. So we've scaled him back, and we let the younger horses take over. Scrappy's he's that. He's a cool horse that really bonds with people, and we'd like to invite you to come visit our webpage at horseshealheartsmi.org, or if you're on Facebook, check us out. Just look up Horses Heal Hearts of Michigan, and I see a typo down there now. So, but it is Horses Heal Hearts of Michigan, and you'll see all the different photos of the different events that we have and have done in the past. And COVID is really making it difficult, but we're going to survive and we're going to get there. So I'd like to thank you for this opportunity, Brianne. I just love working with you guys, and Pandora, thank you so much for the time today.
Absolutely. And thank you so much. You know, I love hearing about the therapy that you're doing. I love hearing all of his cares diminished in the world. That is amazing, because all you're doing is focusing on the horse. You're not focused on anything else. And love hearing about the respect, the improved communication, the social skills, the empathy. And when we get to Q&A, David, I'd love to talk a little bit more about what your vision for older adults and older adult interaction is. So
Okay.
remind me when we get to that. Thank you so much.
Thank you.
So our next speaker is Jasmine Teachout. She is the founder of Motivated and Moving. And I would love to have her jump on and tell a little bit about what she does. And yeah, Jasmine, you have about 11 minutes.
Okay, thank you, Brianne. I appreciate it. Thanks you guys for organizing this. It's nice to have a community resource like this. Pandora, I like the way you described it earlier. I was not aware that it just began in 2000 to help kind of fill this gap. So I appreciate it. So I am, as Brianne said, with Motivated and Moving, I am a licensed physical therapist that worked in multiple settings over the course of the years. Well, I loved that population. I was able to observe a diverse group of patients on a regular basis, and I saw a need for a senior service. That's what I developed this Motivated and Moving based upon. So we saw frequent flyers often. These seniors would come in and they would gain their functional and objective progress, and they would be discharged. They would come back to us a couple of months later with a big old smile on their face, the same one they left with. But I just wish that I could fill that gap for them. Obviously, insurance does play a role. So I developed this based upon that need there. So we don't only see patients or former patients to physical therapy or former patients to anything, but we are often referred to by caregivers alike in the sense that they feel like their resident or client they're working with could benefit from our services. So what we do is we develop a curriculum for them based upon their needs and goals. I do not require a family member present on our initial assessment just to give them a little autonomy, especially these days when they feel like that has been entirely removed from them. But I do encourage, I have brochures for them to pass along the flyer of information to their family in the event that they are interested. We try to encourage our services 1 to 3 times per week, similar to a physical therapy schedule, if you will, because our needs are somewhat related. With that being said, we do not only focus our curriculum based on their physical or functional or objective needs, we also touch a lot on a total of the 6 dimensions of health and wellness. So we focus on social, environmental, spiritual, physical, mental, and intellectual. COVID has obviously played a huge role in emotional health, just overall well-being. They're much less motivated than they were before, and we have focused an entire huge amount of our services on that right now, just to help get everybody reacclimated. An interesting part of us, and it may be pretty obvious, we do not work with insurances, so I'm not billing insurances. A licensed physical therapist assistant does work under the direction and supervision of a physical therapist, so they need to be involved in the setting. So that's why we are not working with insurances. We are strictly like after their discharge, or if there's just a need and they don't maybe need the formal therapy, just something to kind of, like I said, hold them accountable and keep them on that track of not losing their functional progress or functional strength that they have. So we can work off of discharge home exercise programs, or like I said, what we have created with them based upon their needs. Our services are not limited to seniors. A lot of the testimonials on the website are from individuals that age range from everywhere. I have younger little athletes that are on my children's teams that they ask me to quickly tape a leg or something before they play, or a neighbor that switched from working in person and has now really transpired into this home, and her ergonomics at home must not be up to par because she's having a little bit of tennis elbow. So I will do those types of things. Obviously, I explained to them that we're not, we're not billing or doing anything like that. So it's, we do sign the liability waiver as you do everywhere, but those are the types of things that we do. If you have any questions, please feel free to ask away. There's a lot of unique services, and with it being a brand new thing that was developed just prior to COVID, we've been able to get creative, if you will, with our marketing during COVID. Our target audience is obviously the seniors. We work individually or with groups. If it's individual, we're able to really focus on their specific needs, and if it's with a group, we will welcome that, especially because there's a lot more social interaction, which is what we're encouraging as well, especially now. And also they're a little bit more comfortable the first couple of times. So we focus on all sorts of different things, but like I started to get into the way that we've been able to conform with COVID. So we have a very strong, solid core of principles and our core values. So with that being so strong, we're able to modify and kind of branch off into different categories because it still falls directly in line with our mission, and it's improved quality of life with these seniors wherever it is that they call home. So we will come to their facility. Another thing that I noticed often is when the frequent flyers would come back, they would have an issue with transportation. They were unmotivated. The weather outside is freezing. They had increased fall risk. So we come to them. Also, for COVID purposes, we've been creative. Like I started to say, we have done apparently a good job at marketing to some of our communities because they've been creative in ways of getting us out there. Last week, this was super special to me because it wasn't last week, it was yesterday. I was in Macomb County and I was hired by the facility there. I was referred to the facility there actually by a therapy company to do an in-service on improving the safety of their caregivers. So that's huge because not only are they seeing that they're realizing how important their caregivers are to their community. And I use the reference of like putting gasoline into the nicest vehicle that you could possibly have. So I used a reference of a Cadillac. I was happy that the nursing staff or the leadership team realized that there was maybe a little higher quality gasoline they could put into their Cadillac, if you will, that runs the whole facility, and just really focus on them and let them know how important they are in the care of their seniors, especially right now. So we talked a lot about that and made them feel special. And then I did get into the, I did obviously cover what I was hired for, but I mean, I built them up and it was really nice. I felt just as excited as they did when they were done. And you can't really fake that stuff. So it was real. It was real. Another thing that we do, actually this morning I confirmed, I'm going to talk to you first about the blankets and then I'll say what I confirmed this morning. I got into a old tradition my grandmother and I did together when I was her granddaughter. I was probably 6 years old. She had crochet needles and often crocheted. So I wasn't super interested, but I had a little bit of downtime. It was summertime and the pool, we actually got sick of being in the pool all the time. I used to go to her house while my parents were at work. Well, anyways, she taught me how to crochet. My family and I recently moved and I found a ball of yarn. With that said, I didn't have the crochet needles, but I started to develop a knot. Well, the knot turned into a blanket. And I figured that I should actually donate these blankets to seniors of these communities. So anytime I do a formal presentation, whether it's in person or virtual, I do donate a blanket. So I have this one here that I wanted to show you guys. They range, this is actually not my favorite color, but all of the other 15 that I have donated this year are very similar looking, different, they're all different colors. But it makes me feel really good when we're all lacking this personal connection right now. It's something that I feel like I can give back to them to make them feel warm and that our arms are wrapped around them when they can't be. Sometimes I even almost choke up, so I have to breeze through that part. But I did this morning. I was able to donate one of that blanket actually to the annual Big Hearts for Seniors events through Michigan Medicine. They have their virtual event on May 27th, and I'm excited to be able to be a part of that and be able to give back to them. And again, fill somebody's bucket, if you will, and warm them up with that. I was also uniquely hired through COVID again to kind of do a motivational speak to this facility locally. It's in Oakland County monthly. So of course I welcome the opportunity, and they actually decided to give me the topic, and they would like for me to come in there and cover what I explained before, the 6 dimensions that we work with. And like I said, it's just been really nice to get to know through these community resources, these different people available, so that even if I am working with a client, if it's not something I'm comfortable with, I'm definitely going to refer to them. And these communities right here allow me the opportunity to learn a little bit more, so that when I am able to go into these facilities and do what it is that Motivated and Moving was created for, I have even more tools in my toolbox to refer them to. So I thank you guys very much. And the only additional thing that might ask for you guys is that if you do feel like you're working with somebody or know of a community that might benefit from our type of services, even if it's just a, hey, Jasmine at Motivated and Moving, this is her unique service. There's nothing like it anywhere. There isn't that I know of. So let her, if it would benefit you guys to spend a couple of minutes setting up a Zoom or something for me to explain the little details. We did recently just launch our website, so that's super user friendly, and another opportunity to nominate somebody to win one of our blankets too. So feel free to check that out. Thank you guys.
Thank you so much, Jasmine. And I love that, you created your company based on knowing that there was a gap to fill. So that was very cool that you saw that vision a couple years ago. That's awesome. And again, I love hearing about the 6 dimensions of health and wellness, and would love to hear more about that in the future. And then, again, we all in this realm know that not losing that functional strength, making sure that we're keeping people engaged physically and mentally is just so important. So you touched on all of those, and I really appreciate it. And of course, hopefully you'll be able to stay on the Zoom call until the end.
I'm available.
Awesome.
Thank you.
Thank you so much. Appreciate it.
Absolutely.
So our next speaker is Caitlin Ridgway. She is the music therapist at Hospice of Michigan. Caitlin?
Hi.
Hi.
Thank you, Brianne.
Yeah,
As Brianne said, I'm Caitlin Ridgway. I'm a music therapist, board certified music therapist with the Oakland County teams with Hospice of Michigan. So this is a great platform, and I appreciate you giving me the time to speak. I've worked with hospice as a music therapist for about 5 years now. I received my equivalency and master's degree in music therapy at Western Michigan University. And in my current role with HOM, I serve patients from pediatrics all the way through adults on our hospice care, all the way through Oakland County. So Oakland County is a pretty big area, but I do my best. My average caseload is normally between 45 to 55 patients at a time. However, with COVID, that number's a lot smaller than it was then. And currently I have about 75% of my caseload I'm seeing virtually. So music therapy defined is an evidence-based practice that uses therapeutic music interventions to work on non-musical goals. Often in hospice, my visits are one-on-one, and music therapy can be utilized to help assist with pain, anxiety, isolation, increase reality orientation, increase engagement, and provide assistance with relaxation. So it's very patient-centered and patient-specific. So we really customize our interventions as music therapists to meet one's needs in the space. So that can look very different from one person to the next. So it's really hard to describe what I do on a daily basis because every day is a little bit different. And that also keeps me interested and excited about my work too. But I'll give you some examples. So I see patients with dementia or Alzheimer's a lot to increase engagement and encourage communication and really focus on what they can do even though their verbalization skills have deteriorated a lot, music can really provide that bridge to understanding. And so somebody whose speech is pretty mumbled and not very clear anymore is still able to sing and have that connection with someone else in their family or their loved ones or their caregiver, and seeing that, you know, they're still in there and they're still there, even if they can't get the words out the same way they used to. I also see patients a lot to help increase relaxation and distract from pain and agitation. So really giving the patient a different focal point to distract from pain music can be such an effective tool to work on that as well. Through the pandemic in the past year or so, the music therapy team across the state has been using telehealth and video visits. In the beginning, we were primarily doing that with the stay-at-home order in place. And now we're still kind of in this hybrid model of visits. So we're seeing the majority of our patients virtually, like I said, about 75%, and we utilize Zoom for those. And then we also have a few in-person visits still where the virtual space may not be appropriate or available, or just the patient's needs are more acute than the virtual space could provide. It's really a temporary model in the current time to use this virtual space. Music therapy is much more successful in person when you can be in the same space as someone and really increase that adaptability to what somebody needs in the moment. But it's been a really great opportunity for us to reach out to patients we wouldn't otherwise not be able to. So we're really trying to take advantage of it, and we learn more about the virtual space every day and how music can be translated in that as well. Some really great things I'm doing personally is in the horizon is I'm presenting at the Joint Regional Music Therapy Conference in March, talking about legacy projects as a music therapy intervention to increase coping and support for patients and their loved ones. I think this whole idea really came up from the whole pandemic, and with COVID coming into play, we were really trying to figure out ways to help our patients and support the families in situations we weren't able to be in person. And so we were able to really provide some more legacy project ideas. And so this whole conference presentation came about from that. So looking at some of the positives out of a really terrible situation is always good. Yeah, and I may not have as big of a caseload as I normally would have, but our teams have been really great at supporting the virtual space and really trying to make that work. And it helps me to provide a little bit more individualized supportive care to the patients I am able to see. So it's been really great. That's all I really have about me right now. I'm welcome to stay. I'm happy to stay on and answer any questions later too.
Yeah, well, thank you so much, Caitlin. We appreciate you explaining your reach and where you're virtual and where you're able to be in person. That's awesome. And I love hearing just about the increased relaxation and the distraction and just setting a different focal point to distract the pain in some cases. So just really appreciate you getting out there and doing that. And then, you know, during these times, I know that it's not ideal, but what we learn is that we do come up with different ideas when we're sitting in our stillness. So I love hearing about the legacy project idea and look forward to hearing about it once you do your presentation as well. So thank you so much.
Absolutely. Thank you.
Yeah, thanks for joining us. And last but not least, we have Alana Nepau. She is sorry, Alana, I have it on my, she is the volunteer program manager at Hospice of Michigan. Go ahead, and I believe you can share your screen, Alana.
Great. Thank you. Yeah, so I work with Caitlin at Hospice of Michigan, and thank you for having me here today. I'm excited to be here. I'm an Oakland County native. I started out my life in Farmington Hills. So if you could, do you see a cute little one-eyed black pug on your screen? Okay.
Yep.
So I want to talk to you. Oh, Constant Contact wants to hear from me. Okay, let me go back to Sammy. I want to talk to you about our pet therapy program, and I'm going to actually stop sharing my screen now that you've seen him, and I lost him. But basically, pet therapy is a really wonderful service that we were providing prior to the pandemic and have had to adapt it, like many of us, into a virtual model since the pandemic. And it is really for the purpose of socializing with our patients and bringing them comfort. So it's different than a service animal. Those are the typically dogs you might see when you're out and about that have a vest on, typically that would say something like, please don't pet me, I'm working. And so that's a service animal. They serve a specific need for a specific person that they're with, whereas a therapy dog, it's kind of the opposite of the please don't pet me. If they had a vest on, it would say please pet me. So they are there to interact with people, and they usually don't wear a vest so that you can pet more of them. I was a volunteer as well as a staff member in our program for about 5 years with the pug you saw, Sammy. He was one of our certified therapy dogs. And many of our dogs are certified through organizations such as Therapy Dogs International, but some of them are not. They might be on their way towards certification. And in those cases, we call them companion pet visits rather than therapy dog visits. And in order to become one of our what we call broadly pet volunteers, they have to be a year old or more, current on all the required veterinary shots annually, and be able to demonstrate that annually. And they have to pass a behavioral interview, and that is really based on a lot of the guidelines from Therapy Dogs International. So I work with a volunteer coordinator in Oakland County who also helps interview the dogs, and I work on recruiting them and coaching my staff and interviewing them, and then we assign them to visit our patients. And of course, like I said, we've had to go virtual, so we've been able to have some of our dogs visit with patients on a screen, and we of course can't wait until they can go out in person again, because most of the benefit is through touching and petting the dog. But I think we all know that it can still bring a lot of joy on camera. If you've ever been on a Zoom call and someone's pet comes on screen, you kind of hear everyone say, "Aw." And if you don't believe me, I will prove it. This is Albert. He is another little pet. Yes.
Aw.
I'm gonna
Aw.
There it is. See? And for added ambiance, you might hear him snoring in the background. So I think that animals, like we saw in David's presentation, have a really incredible way of relating to people, especially seniors. And my background is in social work with seniors, particularly those with dementia. My master's of social work is from the University of Michigan. I also have a certificate in advanced clinical dementia practice from the U of M School of Social Work. And they are one of my favorite populations to visit with and work with because they really need those kinds of modes of communication that can reach in and draw the person out behind the disease. So animals and music really have a way of accomplishing that for patients who maybe can't express themselves verbally, or even with facial expressions. If they have an advanced disease like Alzheimer's, animals have a way of interacting with them that they can respond to, whether they can just pet them with some help or even just looking at them. And there have also been times where they can help a patient share memories. They might jog memories for a patient who might remember their childhood pet or a pet they had for a long time in their adult years. They might mistake your pet for their pet, and that's okay too. I had a woman who I would visit with, Sammy, who every time we visited, she would tell me all about her dog that she has. And that was not a dog she had at the memory care facility, but it brought her joy in talking about it. And even though I knew I was going to hear that story every time, it brought me joy every time. And we've had other instances where I have had with Sammy, I don't know if I mentioned he was blind, he had one eye, but he would have a way of knowing when someone needed him. He would oftentimes put his little paw in someone's hand and just hold hands with them. Or just put his entire focus on that patient when usually it was on mommy. So he would also have a way of knowing who in the room needed him most, you know, which I didn't know. He would know that first. He would find that person, and it might not have been the person we came there to see. So other times he would just seem to understand things that made me think, wait a minute, you know everything we're saying, and you just choose which things to respond to. There was a patient at our inpatient unit who he couldn't really reach and pet him. He didn't have the dexterity to. So I asked Sammy if he could just like kind of rub the patient's arm, and he did. He rubbed his little head on the patient's arm, and that was one of his last visits before the pandemic hit, and he passed, actually, the patient and Sammy. So it's a really extraordinary thing. When we are in a post-pandemic world, I'll be looking for more well-behaved, personable dogs who can visit with our patients, because the demand always outweighs the supply. It's especially important for patients who reside in facilities such as nursing homes or assisted livings, particularly memory cares, where they may have always had a pet in their home and now they can't, because they're in a assisted living or, you know, some kind of facility where they're not able to care for themselves fully. So certainly they can't care for another living creature. So getting that one-on-one attention from a dog visiting just can mean the world to them, and it can have lasting effects on their mood for the rest of the day. A patient with Alzheimer's might not remember the pet visit took place, but they will have the residual effects on their emotions, and that can make life easier for the patient and their caregivers. And the caregivers, the staff at the facilities, get as much out of the pet visits as I think the residents do. How am I doing on time, Brianne? Okay, so
We still have
what
about
else?
5 minutes. You're doing great.
Oh, wow. Okay, so we have had a lot of instances where we've been able to have a dog visit a patient who maybe hasn't seen a dog in a very long time. And we do accept all breeds and mixes. We have everyone from a 4-pound Chihuahua named Guppy to a Great Dane named Zoe. And we used to call her our horse, but now that I've seen David's, I kind of have to rethink that. So I'm going to show you some pictures now. I'm going to go back to sharing my screen so you can meet some more of our dogs. This was Beely. He has since passed, and this was Lola. They were both some of our pet volunteers, and that was from an event we did at Bloomer Park in Rochester Hills. It was the Bark for Life, so it was like the Relay for Life cancer walk, but this was specifically for dogs. And that is Otto. He's also he was one of our therapy dogs, and you can kind of see he has a little ID badge on. So all of the dogs get the same kind of badge that our people volunteers get. That's Lola and Sammy. Sometimes I'd put him in his blue polo. And that's Lola and Otto. And then in the background, you can kind of see Beely. And that was Sammy. He was manning the expo table. Unfortunately, he could not have any of these cookies. Sorry, Sammy. This is Misty. She is one of our staff members' dogs who became a volunteer. This was Cricket the cat. So it's not always necessarily a dog. We've had bunnies, cats, and dogs. We've also had some parakeets who have visited patients. This is another one of our pups. Some of these are in regions outside of mine. I don't know all their names, but I can tell you they're all volunteer dogs because this is my folder of volunteer dog photos. So you can see sort of the variety of those who have visited, and they're young and old. Big and small. So big, small, and these are all from their interviews at our office. So we do have the dogs come in and do an interview with us, and we're sort of going through a checklist of behaviors. And I really love that picture. Pugs, I think, make excellent therapy dogs, by the way. This is Gemma and Vince. Vince is one of our current pet companions. He does virtual visits with his owner, Eddie, and they are actually based out of Oakland.
Oh, darn it. It sounds like
Is it?
oh, there we go. We're having some technical difficulties, but keep on going,
boy.
Alana.
Okay. Thank you. And you're going to see a lot of Sammy, and I'll just tell you a little bit about him. He was a rescue with Michigan Pug Rescue. He had one eye removed due to glaucoma. The other one had a pigmentation disorder, so that is why it resulted in his blindness. And I also called him my office assistant since he was a certified therapy dog. I brought him in, you know, to help with filing, data entry, that kind of thing. Oh, that was Gemma at her interview. She had a haircut that made her look like a lion. Oh my goodness, this is one of our Traverse City pups because we are a statewide org over the Lower Peninsula. And that was Leon, one of our companion dogs at our Ann Arbor area, and he has since retired. That's Leon again around Halloween. That is not Leon. That's Liza. She recently passed, but she was with us for almost 10 years as a volunteer. This was her helping at our children's grief camp. So they don't always just visit patients, but when we have events, you'll often see our dogs at them. And sometimes they would be specifically requested to visit clients for bereavement. So a family member of a patient who passed on our program would often ask to be visited by a dog, and sometimes it was an adult, and sometimes it was children. Sammy and I visited a patient with a family with 3 little girls who had lost their youngest sister very tragically. So that's Liza at Camp Good Grief, and that's her person, Betsy. And you can see the kids had a lot of fun with Liza, and Liza got a camp t-shirt. And a lot like David was mentioning with the horses, when a therapy dog goes through the certification test, they also have to be really calm when there are loud noises, when there are crowds. You know, it's got to be a dog where if 10 children or seniors come up to them at once, they'll respond calmly, and they'll respond calmly around other dogs. That was one of Lola visiting a patient. This patient was really fascinating. She did not speak to people, and it was not as a result of her disease process. It was a choice. She really didn't like people. You know, some people say they like pets better than people, and she was the living embodiment of that. And she would love the pugs that visited her. This was a visit with Lola. You can see she's laying across her lap. And she would talk to the pugs, and she would talk to the owners. But that was pretty much the extent of her conversation.
That's wonderful.
Yeah.
Well, thank you so much, Alana. I really appreciate you sharing. I love that you are interviewing well-behaved dogs. That's amazing.
Yeah.
And just the connection, just like you said, with David and the animals, there is just such a connection. There's a different connection, and a time where you do feel those residual emotional effects and those lasting feelings, which are just oh so important. So thank you for sharing all of that.
You're welcome. Thank you. I'll stop sharing now. This was Bewee and his owner Purette, some of our a pet duo that also visited this patient.
Aw, I love it. I love it. And I can't thank everybody enough for speaking today, but I also have to thank Pandora for getting everybody together on our call today. It's no easy foot trying to get everybody together and get recorded and connected and everything. So I really appreciate that, Pandora. And I'd like to open it up for questions, but before we open it up for questions, we have about 15 more minutes, and Caitlin agreed to sing us a song. So do you mind jumping on, Caitlin?
Yeah, let me just grab my guitar.
All right. I think that would be really nice.
So I thought I could share this as a story of a virtual visit that I did this week. I have a patient who loves to sing along, but especially when we put her name in the songs, oh, she just smiles ear to ear. It's wonderful. So a song we like to put her name into is Ain't She Sweet? And instead of she, we put her name, but I'll just sing Ain't She Sweet? Oh, ain't she sweet? I see her coming down the street, and I ask you very confidentially, ain't she sweet? And ain't she nice? I look her over once or twice, and I ask you very confidentially, ain't she nice? Just cast an eye in her direction, oh me, oh my, ain't that perfection? A-do-do-do-do-do-do. Oh, I repeat, don't you think it's kind of neat? And I ask you very confidentially, ain't she sweet? Oh, I ask you very confidentially, ain't she sweet?
Thank you so much, Caitlin. I really appreciate it. Very, very nice. So I want to open it up for questions to any of our speakers today. I know that we had a few. Maybe I'll start off with David. David, what are you doing specifically with our older adult population? I know that you had talked about ALS specifically and Alzheimer's. Do you mind jumping on and telling us a little bit about what your vision is there?
Sure. We've worked with Alzheimer's groups where we bring them out to the farm, and we also match them up with a younger group. And the chemistry then, a lot of the Alzheimer's patients are reminded of their grandchildren or their kids when they're younger, and they seem to come out of their shells a little bit, and the kids love it too because they get that sense of I'm helping somebody as well. So we do some different things like that, and we try to cross match groups as much as we can. So that's a really cool thing we do with them. But we've gone to rehabilitation centers as well, and we've had patients who I'm sorry, I got dog hair in my face. My little one's jumping all over me like it's time to eat, it's time to eat. But we go out to these rehab centers, and we had one occasion where they brought the patients outside to see the horses. And there was one lady, she was an elderly lady, probably in her late 70s, early 80s. And she had a massive stroke. So she didn't talk. She could only move her hand. That was it. And so she put her hand up to Top Secret's mouth, and she just kept playing with his mouth. Now imagine if somebody was doing that to you, you'd probably get a little ticked off, but Top Secret's trained. He knows he was working. And, everybody's like, the caregivers were like, Dorothy, what is that? What is that? All of a sudden you hear horsey. And everybody just fell out because she had been there for like 8 years and nobody had ever heard a word out of her. But that's some of the things we can do. We can visit sites. We can collaborate on events with different organizations. Our farm is always open to anybody who'd like to come out in Fenton. It's not too far from, with the freeways and everything, it's not too far. So I live in Livonia. I can make it there in about 30 minutes. It's a pleasant drive, and we've got 75 acres of farm. So it's a couple swings out there, and we're developing a lot of different things at the farm to be more appeasing. So once we get our fundraisers going back again, we'll be able to do those kinds of things.
Yeah, and that's a great question too, that I wanted to see if all of you could address. Do any of you have any upcoming events or fundraisers that you're planning for the spring or summer?
Ours will be in October, but
Okay.
yeah, it'll probably be a virtual event if everything still hasn't simmered down. But if it isn't, it usually is a live auction, dinner dance type thing.
Very cool. And Jasmine, Caitlin, Alana.
Yeah, there's a couple questions in the chat feature too.
Okay, go ahead, Pandora.
My identical twin, Pandora Riley, wants to know, to utilize pet therapy in an assisted living community, do we have to have a resident in hospice with Hospice of Michigan?
Not necessarily. I would say to reach out to, I can give you her contact info, the marketing person that we have in that area. Her name is, well, depending on where you are, it's either going to be Kim Little, Susan Kuhar, or William Walsh. So I have got my info in the chat, so you can reach out to me. And of course, we're not doing visits in person now, but we will be after the pandemic eventually. I saw that someone in the chat was from Menugian Manor. That's actually one building I visited with Sammy. We've been to dozens of buildings. So
That's actually the lady to ask the question. She's from a new
Yeah.
mansion.
Oh, yes. I used to live in Livonia right by there. So yeah, I'll put my info in the chat again though, so it's fresh. You can shoot me an email.
And just as a reminder, all of the speakers today, we put your information in a follow-up email with the recording, so everyone can get a hold of you as well.
And
Very
Megan had a
good.
question for Jasmine, but she had to jump off. So I guess they're going to be in contact with each other. I'll just read it really quick. She says she knows so many teen musicians who's isolated from a lack of community within their band, orchestra, choir, and they're doing Zoom calls, etc. But what is the best way to encourage these kids? So Jasmine, you're going to reach out to her with the answer to that. Or did you want to answer now?
Or did you say it was in reference to music therapy?
Was that maybe for Caitlin?
Oh yeah, I'm sorry.
I
For
think so.
Caitlin.
No, that's okay.
I'd be happy to reach out, but I would just say that motivation, just finding songs and different activities with the music that keeps them engaged. It may not be doing that group activity of the band or the orchestra that they used to be a part of, but actually doing something maybe more one-on-one or with a parent or sibling, really getting somebody who engaged who maybe wasn't engaged before, but it can really kind of boost that encouragement to the person learning.
Well, thank you so much. It's hard doing everything Zoom. And I know these kids are really missing their sports and, band, orchestra, etc. Just trying to get used to this whole Zoom thing has to be really difficult. I think that's it.
Okay, great. Well, Brian, do you want to go ahead and share our screen again so we can just remind everyone when our next Zoom call will be? All right, Pandora?
So our next Zoom call will be on the 18th of March. March is National Women's History Month. And so if you all know anyone that would be a good speaker for this topic, that would be great. We're definitely open to any ideas or speakers for this event. Thank you all again for joining.
Yeah, thanks so much, everyone. And again, thank you to our participants. You guys are great. And I love the music and seeing the animals and seeing the blankets. I can't thank all of you enough. And I hope you have a great rest of your day and a wonderful weekend. Stay
Thank
warm.
you.
Bye, everyone.
Thank
Bye.
you.
Thank you.
Thank you.
What?